Well, have you ever heard of the saying, an apple a day keeps the doctor away? Well, unfortunately, we all know it is not that simple. But fortunately, CBS News has come up with a solution. Our HealthWatch team has compiled a series of guides outlining which preventative screenings and other care Americans should receive throughout their lifetimes. They delineate the types of illnesses and diseases all of us have the ability to catch early and when exactly we should start checking for them. Dr. Celine Gounder helped review the recommendations for these guides. She is a CBS News medical contributor and an editor-at-large for public health at the Kaiser Family Foundation. Dr. Gounder, thank you so much for being with us and talking about this because it's so incredibly important, and I think it can be overwhelming, right, for a lot of folks because there are a lot of screenings that we can talk about today. But I want to start with cancer. Because that is something we hear a lot about. Walk us through the kinds of cancers people should be screening for and when. What does that time frame look like?
Well, starting in your 20s, women should be getting cervical cancer screening. So that's with a Pap smear. In your 20s, you should be doing that every 3 years. By the time you hit your 30s, you can space that out a little bit more to every 5 years. What's really tragic here, though, is we have vaccines that are highly effective in preventing cervical cancer. And compared to other countries like Australia, Canada, we're just not using them here in the United States. So this is something we really need to be pushing a lot more to prevent this preventable cancer. Once you hit your 40s, women should be looking at breast cancer screening, 45, colon cancer screening, and it's important to note there that the age for that has dropped. And then once you hit 50, if you've been a smoker, lung cancer screening, for men, prostate cancer screening.
Okay, so let's also talk about heart health and sexual health. What should people do to stay proactive on those fronts?
Well, unfortunately, in the U.S., we have very high rates of obesity, of high blood pressure, of diabetes, which all put you at risk for heart attack, stroke, and other complications. So really starting in your 20s, you should be starting to pay attention to those things. By the time you hit 40, your doctor should help you calculate your risk of heart attack, of stroke over the next 10 years, which determines whether you need to be on what we call a statin, so medications like Lipitor, Crestor, et cetera. So in terms of sexual health, the United States has seen a big increase in STDs over the last 10 years. Chlamydia, gonorrhea, syphilis are up. This is in part because people are using condoms a lot less, which is an unfortunate trend in terms of preventing not just STDs, but also HIV, hepatitis, unwanted pregnancy. But we should be testing everybody at least once in their lifetime for HIV and hepatitis C. And if you're sexually active, especially not using a condom, you should be regularly screened for chlamydia, gonorrhea, and syphilis.
Okay. You mentioned a moment ago vaccines. Getting vaccinated is an incredibly important way to prevent illness. What should people be getting shots for and at what ages?
So every year you should be asking about influenza, the flu, COVID, and for some populations, RSV. So that's a yearly thing you should be talking to your doctor about. In your 20s, you're talking about catching up with childhood vaccinations, making sure you're up to date. So again, the HPV vaccine is really important here. MMR, which includes measles. We've seen outbreaks of measles more recently. So those are things to ask about. Once you hit your 50s, you're talking about the shingles vaccine. So this is related to chickenpox. If you had chickenpox at a younger age, you're very much at risk for shingles later. And then once you hit your 60s, you're talking about RSV, which is a virus, as well as pneumonia shots.
So throughout your life, I mean, there are ways to kind of, as these kinds of illnesses or conditions kind of pose greater risks, there are measures that people can take.
Well, just like you have to take your car in for a regular tune-up, it's similar, your risks do change over the course of a lifetime, but you need to keep up with that good maintenance to keep yourself healthy.
Yeah. What are some other tips, Celine, before we let you go? The idea that there are things that all of us can do to try and stay healthy, whatever their age. Some people might think, you know what, it's too late for me. I'm already set in my ways. There's not really anything I can do to change my trajectory. What would you say?
It's never too late. So if you're still a smoker, quit smoking. If you don't exercise at all, even just walking a little bit every day, taking the stairs instead of the elevator, very small things can really make a big difference for your health.
All right, Dr. Celine Gounder, always great to have you. Thanks so much. And a reminder to viewers, for more information, this is really important, on preventative screenings and more, you can visit cbsnews.com/healthwatch. Dr. Gounder, thanks so much.